Very good evening to everyone this evening. My name is Paul Maver. I'm a chief pharmacist from Health House International. I'd like to formally welcome everyone along to the educational webinar, Medicinal Cannabis for Chronic Pain. We've had an absolutely massive response to this webinar, and I very much look forward to some of the questions at the end. If you do have any questions or want to know more, please do use the Q&A function at the bottom, not the chat function. And firstly, I'd like to start by giving a disclaimer. We're not here promoting medicinal cannabis as a treatment option. The information tonight is for educational purposes only. If you do have any questions or specific need for medical treatment, please consult your healthcare professional. I'm going to start this evening by giving a big shout out to Zara Champion and the team from Biotech New Zealand. They've been doing it tough and had to reschedule their live event, MedCan. These are the new dates, the 10th and 11th of February 2022, and I'm hoping to get there and travel internationally. It'd be nice to hop on a plane again. I know there's a bunch of Kiwis watching tonight, so welcome to you guys. Thanks for staying up so late. So these are the actual live figures from the TGA's website. Pain is a massive subsection of all prescriptions, and recently we've hit, as of today, 172,091 SAS Category B patient approvals. On top of that, there's a bunch of authorised prescriber approvals. But as you can see, pain is more than double all the other conditions put together. And chronic pain is number one. We've got cancer pain at number 3 and neuropathic pain at number 5. But if you put all the pain conditions together, it's a massive subsection. So, which is why we're running our webinar tonight, and we're hoping to do a deep dive into medicinal cannabis being used to treat chronic pain patients. And we've got some very qualified speakers. We'll have for you later on this evening 2 medicinal cannabis patients telling their story, and it's really important that they do, because we're going to be presenting a lot of science this evening, but it's important that you hear it firsthand, the benefits. We're fortunate enough to have with us this evening 2 medical cannabis prescribing doctors. We've got Dr. Michael Platt, who is Australian born and trained, and now works as a pain specialist in London, where he is medical director for Sapphire Medical Clinics. We're also lucky to have Dr. Crosby Rechtin. Crosby is US trained and now an Australian GP specialising in medicinal cannabis. Crosby is the Chief Medical Officer for the CBD guys. Heading up this evening is my learned colleague and fellow pharmacist from Health House, Dunya Hadzamerovich. Dunya is going to get into some heavy science and give you a bit of a rundown on the endocannabinoid system, which is one of the key components of where cannabis is working and treating some pain patients. So it's important to have a bit of background knowledge. Once again, if you do have any questions throughout or the end of the seminar, please do feel free to use the Q&A function, not the chat function down the bottom. Thank you very much.
Hi, my name is Dunya, and I'm one of the other pharmacists here at Health House. And tonight I'll be covering a little bit more about the endocannabinoid system. So a system that is within the human body and being utilised through medicinal cannabis management as well. So if we jump back to the early 1990s, we know the endocannabinoid system is now biological, able to influence a lot of the functions within the body. And in 1992, Professor Raphael Mechoulam, an Israeli scientist, and his lab team discovered an important endocannabinoid that we now know being called anandamide, which was crucial because of its partial agonistic effects. So partially activating a receptor that was earlier discovered called CB1. And that interaction helped regulate a lot of certain functions of the human body. things like immune function, inflammation, pain, appetite, nerve development, our mood, and sleep as well. It meant that after 1992, the journey led to discovering some of the other key components, things like other receptors like CB2, 2AG, which is another endocannabinoid that we'll talk about later, some of the enzymes involved, some of the ion channels involved as well, and the signaling pathways with proteins that then lead to changes in the functions of the body. But with the ultimate aim, as doctors and scientists like to call homeostasis or balance in the function. So because tonight is about covering chronic pain, what I wanted to delve into further is the key components involved in the ECS and how they help manage the pain, where they're located, and the functions that result from it. So the first one, the receptors that we've spoken a little bit about, they were discovered in 1988, and that was 2 years after THC was used in a lab to see how the receptors responded to it. What we now know is they're mainly located in the central and peripheral nervous system, but CB1, which is pictured with the green dots on this slide, is predominantly located, I should say, in the brain, as well as in the GI tract, so the digestion area, and the lungs as well. CB2, on the other hand, represented by the blue dots, is mainly located in the peripheral nervous system and the immune system as well, so some of the cells involved, as well as the liver, as well as the spleen and tonsils. The image basically also demonstrates what happens when these receptors are activated. So when a patient administers medicinal cannabis, we're mainly focusing at activating the CB1 receptor, so the green dots. And what happens is patients can have effects like reducing pain, nerve pain, spasticity. It can also help with reducing the onset of nausea, so for patients with chemotherapy treatment. And it can also regulate things like the seizure threshold, so patients suffering from severe forms of epilepsy. So these are examples in general in terms of how medicinal cannabis can help certain conditions. But the question is, what happens really when it's being used for chronic pain for tonight? So the other components to be aware of are endocannabinoids, which are endogenous compounds. So they're produced within our own human body. And the main two discoveries, I mentioned one earlier being anandamide, represented by the green square. And then the other one is called 2AG, represented by the orange triangle in the image. So you might have heard of runner's high, that feeling of goodness after exercise. Anandamide is actually named after that, ananda meaning bliss. 2AG, on the other hand, is actually useful to reduce pain, vomiting, and it can stimulate the appetite as well for individuals as a few of its functions. So what got scientists interested is to try and mimic these effects. And the way they discovered that was through deriving molecules from a plant, or what we now call as phytocannabinoids in medicine. And the main two that are being utilized are CBD, pictured in the blue dots, and delta-9 THC, or tetrahydrocannabinol, so the represented in red. There is actually over 500 different compounds that can be extracted from this plant, but the main ones we focus on are what's called phytocannabinoids. And that's because they're actually mimicking the chemical structure of endocannabinoids. So it seems to result in a very similar effect of biological processes within the human body. And the question is, how can THC and CBD specifically help in chronic pain? So if a patient has an injury, as an example shown bottom left, a stimuli activates certain peripheral nociceptors, so the receptor police that exist and sense painful stimuli in various locations of the body. And that signal gets converted towards the brain and activates certain mechanisms, things like inflammation or trying to repair the nerve damage that has occurred at the site. The process also can induce a state of what's called peripheral hyperexcitability. So that really means nerve endings continuously firing at the site of injury and beyond. And those nociceptors that pass that information on towards the brain and spinal cord can also have dramatic functional changes over time. Things like losing that activity in stopping or inhibiting too much of the firing that is happening for the body. So the body is continuously experiencing pain. If this starts to happen for more than 3 months, as a definition of chronic pain, that's when we would speak to patients about that diagnosis of persistent chronic pain. So it's mainly sensory disturbance and functional impairment. And that's why chronic pain can be quite difficult to manage. One way to organize the management plan for a patient is through medicine. And so that's with the introduction of phytocannabinoids to their medication management plan. So what really happens down to the receptor level is we spoke about CB1 receptors being activated, and this is at a nerve ending, where they're able to inhibit certain neurotransmitters that normally form in a bubble or a vesicle that gets released into what's called the synapse. So the little area between the nerve endings that communicates towards another few receptors in the postsynaptic neuron that usually would pass on the message of firing or activity towards our brain. So these phytocannabinoids actually reduce the continuous messaging across. And that's one way to help manage chronic pain. So hopefully this is a quick overview, I'm sorry, about the endocannabinoid system, but it does demonstrate a little bit more of the key players involved and how they can help. Thanks for listening.
I'm here with UK-based pain specialist, Dr. Michael Platt, who's Medical Director of Sapphire Medical Clinics. Hi, Michael.
Hello.
So cannabis as a pain treatment, I understand, like myself, you started out as a skeptic. What did you see that got you across the line that this was a valid treatment?
Well, I saw my first patient, I remember well, in April 2018, in fact. And she had very severe fibromyalgia. She could not walk more than 1,000 steps a day. She used to count her steps. And so I started her on our broad spectrum oils using low dose CBD and THC oils, which have all the other contents of the cannabis plant in them, because we find that's more effective than just CBD isolate or THC isolate. And when I saw her a month later, she was a different woman. She was brighter, much more cheerful. She said she was walking 5,000 steps. And then she used to send me messages saying, well, today I did 10,000 steps. And I suddenly realized this really was working for her. And over the last 2 or 3 years, I have found it incredibly effective for many, many patients with fibromyalgia, with Ehlers-Danlos syndrome, with all the complex problems that we find very difficult to deal with our normal, in inverted commas, medications.
Now, I understand cannabis isn't first-line treatment. What are the various steps of medication and other treatment patients have to go through to access this?
So we see patients, they can self-refer online, but we get their GP summary of care record as well, so we make it all above board and things. We insist that they have had treatment for their condition, that it's been properly diagnosed, that they're being treated properly by the appropriate specialist usually. And so people with complex neuropathic pain need to have tried anti-neuropathic pain medications, for example, and then there's no problem, no issue then. Part of that is to ensure that the MHRA, our drug regulating body, is happy, because that they've actually said that to us, but make sure they've had proper diagnostic treatment and they've tried normal, in inverted commas, treatments prior to prescribing the cannabis. And that's what we do, basically. Anyone who comes who has not had that, we send them back and say, come back to us when you've seen so-and-so, or started such and such drugs. Okay.
Yep. And at a basic receptor level, what is the cannabis doing? Can you explain that to some of the viewers tonight?
I wish it was simple. It is very complex. The more I've read up about it, the more complex the system is. Basically, the endocannabinoid system is involved in all the systems of the body to varying degrees. All the systems, they have receptors for both THC and for CBD and similar drugs. There's some evidence that the CB2 receptor, which binds to the CBD, and 2-delta-9, which is the body's version of it, actually can change shape a little bit, and other molecules can seem to be able to bind to it. There's a bit of a puzzle going on at the moment, because they've discovered that terpenes are incredibly effective at helping the cannabis molecules. And so it's a bit of a complex system which we still don't understand. It's extraordinary, really, that it was banned for 100 years, so there's been so little research. And it's only really in the last 4 years that we've really become aware of the endocannabinoid system to the degree we have now. And so as time goes on, I think it'll get more exciting. I think Big Pharma will become more interested once they can look at perhaps mixing different molecules together of the cannabis system. But at the moment, because they're only interested in single molecule effects, that probably won't happen. So at the moment, what we do, our clinic has links with growers in Portugal, and we have links with pharmaceutical engineers in Thailand and Weir, so we can control the cost much better than most others can. And we also manage the standards. So the pharmaceutical agents produce consistent medication with consistent contents. And there are a number of different medications, including oils of different concentrations of THC and CBD, which are the only two things we control. We do isolates as well as broad spectrum. And we also do dried flower for those who vape as well. And people vape it, especially those people who get peaks of pain during the day. So they use the oils to maintain a constant blood level throughout the 24 hours, but then they vape extra during the day if they get peaks of pain during the day, and that seems to work.
Are there any other interesting pain cases that you've seen it be effective for or not?
Oh yeah, for Ehlers-Danlos syndrome is a very underdiagnosed syndrome, I find, and it needs to be diagnosed by a rheumatologist. But it's not just hypermobility; it's a spectrum. So you can have just hypermobility and nothing else. At the other end of the spectrum, you have hypermobility, which can be severe, causing dislocation of joints and things. You can have chronic bladder infections, mast cell activation syndrome, causing lots of rashes, slow gut transit time, causing lots of problems with stomach emptying and constipation and so on, and lots of other things as well. And there's an overlap sometimes with SLE, systemic lupus erythematosus, as well. It's a very interesting area, which needs a lot more research, I think. And I see a lot of these patients who are not properly diagnosed, and I send them to a rheumatologist for formal diagnosis, and they do very well on cannabis medication. They do need other things as well, but the cannabis seems to give them a baseline of relief. So and the first thing they tell me is it's the first good night's sleep I've had for 20 years or whatever. It's quite extraordinary, really. Well, and I think there's no doubt that it's very beneficial for these patients. And I think some of the most complex patients I've seen. I remember a lady who was a singer, and she was losing her voice, and it turned out that the muscles in her larynx were being affected because she had Ehlers-Danlos syndrome, and the collagen was too loose and stuff. And she benefited actually from the cannabis. It didn't stop the thing, but she felt more comfortable and she felt she could sing better, which was interesting. Yeah,
that's right. Now, just lastly, and now I understand in the UK where you're based is specialist prescribing only for cannabis. Why haven't they let GPs loose? Because I would have thought they were a better place to manage pain patients.
I think it's because the NHS has not recognised it as such yet, and I think it has to be recognised by the NHS for GPs to prescribe. So what they've done is they've said any licensed practitioners can do it. we can't prescribe it on the NHS. We can only do it privately, which is why patients have to pay for it. I mean, I've even offered to do free clinics in the NHS, but of course they still have to pay for the product. But no one will wear it. There's a lot of nervousness, I think, and a lot of fear over it. And the opioid crisis, I think, hasn't helped because it's engendered a kind of fear for these types of drugs. But we know that cannabis is very, very safe. And the only things we watch out for really are any drug interactions. So be careful of patients who have or on blood thinners, for example, especially clopidogrel. And patients with cardiac disease actually seem to be okay with it, but be careful if they've got any arrhythmias because that can be affected. And also in some patients, you can get some gastric disorders. It's pretty rare, but can happen, which we see occasionally. Otherwise, it seems to be quite well tolerated, or it's generally well tolerated. And patients, you know, you see them, they're different patients. You see the elderly patients, actually, who I first see, one of them wouldn't talk to me, and her daughter talked to me. She was about 80, and she had severe pain generally. And the next time I saw her, she was talking, she was bright, different lady altogether. So it does help people a lot.
Right, great feedback. Well, it's been absolutely fascinating chatting with you. Hopefully you can join us for the Q&A a little bit later. Thank you very much.
Yes, pleasure. Take care. All the best.
Now, I can talk about cannabis science and evidence till I'm blue in the face, but it's much better to hear patients' first-hand accounts. I'm here today with a medical cannabis patient, Jane, who's going to recount her story taking medical cannabis. Hi, Jane.
Hi, Paul. So last year I had a laminectomy and a fusion of L4-5 and was put on Alexia, an opiate, and you know they're very strong drugs. And when I found out I could have medical cannabis, I decided to go on to that and gradually weaned myself off the Alexia. And since then, because I had a bone graft with the fusion, I was not able to continue my anti-inflammatories. And now I don't think I'll ever need anti-inflammatories again. I was hoping I'd only be off them for 12 months, but I don't think I'll ever take them again. I've had no side effects, no downside at all, only upside.
Can you explain the sort of pain you're in before when you took the opioids and what sort of side effects you had on the opioids, epilepsy?
Yes, I was on a high dose, 150 milligrams, so I thought it was high, and I felt a bit fuggy in the head and not my full self. And I'm a very active person normally, although this pulled me up short having this surgery. And so I was in quite a lot of pain after I'd had it, and I wanted to be able to do things and be pain-free. And that's the reason I took these, and it was recommended to me that I did by my medico and by the specialist. And so I took them. You know, you take the advice of whoever you've seen. And then when I found out the other thing was available, the cannabis, the medical cannabis, I decided to go on that so I could ease myself off it. And I thought, I'll see how this goes. And it's been fantastic. So the pain level was pretty high, but the Palexia did dull the pain, but dulled me as well.
Yeah, and that's interesting. And are there any side effects at all on medicinal cannabis?
None whatsoever.
And on a scale of 1 to 10, what sort of pain were you on previous, what were you on with the Palexia, and what are you on with medicinal cannabis now?
Well, as soon as I'd had the surgery, I was up there around 9. It was very, very painful.
Yeah.
And then gradually with the introduction of the Palexia, it got that down, you know, reasonably to less than 4 or 5. And then since I've weaned myself off that, and, you know, after 2 months, and then got myself onto the medicinal cannabis, then I really don't have any pain unless I've been overdoing it. And then I get a bit of a sore back and I go and put a heat pack on it for a while and I'm ready to go again.
Yeah. So it's improved your quality of life?
Yeah, absolutely. Absolutely. Yeah. I'd say totally controlled.
Yeah. And lastly, has anyone made any jokes at your expense taking medical cannabis?
Yes, our daughter who lives in Melbourne, whom we hadn't seen for over a year, and she was flying to Perth to say hello. And I said to my husband, don't just wait outside for her to come out with her luggage. I want to go in and greet her because I haven't seen her for so long, dying to give her a hug. And Alison's response to that was, oh, you better tell mum not to come in or the dogs will be in a frenzy. The drugs inside.
Thank you so much for sharing your stories with us. It's been fantastic.
Yeah.
Lovely to talk to you.
Pleasure, Paul. Bye-bye.
That's good.
They probably hear it. Okay, so Dr. Rechtin, nice to meet you officially. First question is, how long have you been prescribing medicinal cannabis?
Sure, nice to meet you as well. So I wrote my first script for cannabis in 2010 in Michigan in the US. But as a practicing emergency specialist at the time, I didn't have many opportunities, mostly in a palliative care sort of situation. But I followed the space and then started prescribing cannabis as my primary role in Australia just over 2 years ago.
Yeah, that's definitely not an easy move all of a sudden as well from palliative care background. So yeah, and what have you found so far with patients in Australia?
Well, generally speaking, the vast majority of patients get some level of benefit. Chronic pain patients are finding some pain relief. Anxious patients are finding calm. Insomnia patients are getting rest. Epilepsy patients are having less seizures. Really is amazing, the range of benefits that are possible. And that's often without any side effects, which is a win for most patients. A large majority of patients are able to reduce or eliminate a number of other medications that have been troublesome for them. So that's been great.
Yeah, I guess for the chronic management, and that is eventually from a pharmacist's perspective, the aim as well, to try and cut down on polypharmacy particularly.
Sure.
Have you had cases where medicinal cannabis may not have worked for those patients or
Yeah.
has had those side effects?
Yeah, just like with any medication, there are patients that don't respond as well as hoped. It's not always a silver bullet that they were expecting or hoping for. The cannabis in particular is a very individualized response. Patients respond differently to every single cannabis medication. And as with most things in health and science related, there's sort of a spectrum of response. And I like to think of it as the classic bell-shaped curve, where there's a few people on one end of the curve that get no benefit at all, whether it be due to genetics or biochemistry or maybe just expectation management. And there's a few people on the other end of the curve that get a full cure of their presenting complaint, but that's pretty rare. Everyone else is somewhere in between in the middle of that curve. And then at that point, it becomes a cost versus benefit analysis. And when I talk about costs, I'm talking about the literal cost of the medication. They're not cheap and only very rarely subsidized. So, and it does take some time and persistence to find the maximum benefit with dosage adjustments and sometimes medication changes. And that all requires regular doctor follow-ups, investment of time and money. And some patients just aren't able to invest that level of time and money. And then they end up doing the math and they realize that if they're going to have to increase their dose, and they won't be able to afford it ongoing. So a lot of patients will just drop out for that reason.
Yeah, that makes sense. Similar very much to the feedback we get here at Health House as well. It's whether we can help them access the medication in an easy fashion and timely fashion as well, because of persistently dealing with something for years. So they've just hit that brink, really, the wall of wanting to change something in their life. So it is really challenging, but hopefully the time taken to reach those subsidies, to reach the medication as well, has really dropped down since even the last 2 years of me working here at Health House. So yeah, no, it's on the plus.
Yeah, that's right.
Have you also had challenges, I guess, moving from the US to Australia in terms of colleagues being skeptical about your cannabinoid prescribing, or particularly here in Australia as well?
Yeah, that's right. I mean, we're in a position right now that the stigma remains, the bias persists. There's been at least 3 generations of doctors going through medical school training being taught that cannabis is dangerous and endocannabinoid system was discovered nearly 30 years ago. As far as I know, still isn't taught in medical school. So
yeah, I was going to ask if you remember if it got touched upon.
no, definitely
when you were
not.
studying. No, yeah. And one of my parents is also from a medical background, and my dad had no idea.
Yeah, that's right.
So it's very interesting.
Doctors are generally fairly conservative, and they take that mantra of doing no harm seriously. So they're rightfully nervous about prescribing medications that they aren't convinced have been studied thoroughly. But at the same time, most docs are definitely curious about it and ask a lot of questions. And in the end, they really just want what's best for their patients and can't ignore the stories of patients whose lives are changed because they were able to get off their opiates or anti-epileptics or benzodiazepines. So things are changing.
That's right, yeah. And in terms of access as well, we talk about the TGA approval as being one of the steps in terms of a patient getting their medication dispensed, so that particular brand and strength. What has been the usual turnaround time for your patients with getting TGA approvals?
Yeah, sometimes it comes back within a few hours, but usually it's more likely 24 hours. Of course, it can take longer depending on the amount of applications. With each subsequent month, the TGA is setting records for patient approvals. So sometimes the system does get bogged down, but and takes an extra day or two. But I haven't found it takes much more than that.
Yeah, that's amazing and dramatically different to even talking a few months or years back in terms of that time frame. We used to hear fastest one that has come through towards us at Health House here is within minutes even. So it can happen. I think it depends on the urgency. Yeah. Well, it was nice to really speak and touch upon a few different areas in terms of patient access. So hopefully we'll have a lot more questions later down the track tonight to chat more. Thank you for your time.
Thank you.
Thanks.
Hey everyone, I'm here with Eve. Eve is a medical cannabis patient. Hi Eve.
Hi, how are you?
Eve's going to be talking about her journey with medicinal cannabis. If you can tell us about your medical condition and sort of the pain you were experiencing previously.
Yeah, for sure. So I was diagnosed with Ehlers-Danlos syndrome when I was 10 years old. Basically, that's a connective tissue disorder that's characterized by widespread chronic pain and dislocations. So all my life, I've had a lot of pain in my body. There's never been a day where I haven't had pain. So I've often tried quite a few different pain medications throughout the years, and it sort of got to the point where I had tried all of them, and then that's when we started looking at what had worked for other Ehlers-Danlos patients around the world, and what seemed to keep coming up was cannabis. So we sort of kept looking into cannabis, seeing as how that could help me. But we did have a few doctors that were sort of reluctant when talking about it with me, because I was around 16, 17 when we were at this point, and doctors were very reluctant to talk about it with me because of my age. So once I finally did find a doctor that knew a lot about complex pain and was a believer in medicinal cannabis, that's when we sort of got started with the medicinal cannabis journey.
Mm-hmm. And were you reluctant to try it before that time, or something you wanted to?
Actually, I wasn't reluctant at all. At that point, I was in desperate need for any type of relief. Had so many horrible side effects from different drugs in the past that I was known that this was a relatively safe drug from what I knew, and that this was all that was left for me to try. So I was very keen to get started with it, and in my mind, there was nothing to lose. Sure.
And out of 10, what sort of pain would you experience on a daily basis?
It's definitely varies. But I'd say my whole body has background pain, which can start at a baseline of 6, and that can escalate all the way up to 10, depending on what's going on that day. When I have problems like a dislocation or something like that, that can bring the pain up to a 9 or a 10, and then that can last for a couple of weeks while that injury is healing.
Oh, sounds horrendous. And what pain relief did the medical cannabis bring? And can you talk about what side effects or any other experiences with that medication?
Yeah, so I found that the medicinal cannabis has definitely helped with the background pain. So when I take it, I feel once it kicks in, I feel sort of instant relief throughout my body. I feel like I'm not holding as much tension because I feel the pain through like my muscles and my joints. So it's just everywhere, and instantly that's sort of alleviated. So it definitely helps with that sort of background pain. But if there's like an immediate dislocation, it doesn't help as much with that. But it has reduced my pain so much that it's made me a lot more functional in my everyday life.
Mm-hmm. As a pharmacist, I'm always concerned with medication. What have you swapped out any other medication you're previously taking?
Yes, I was able to get off some really nasty drugs that I was on that was causing me some horrible side effects. I was able to reduce the amount of opioids and analgesics I was taking. I was taking quite a lot because that was all that was available for me. So to be able to cut that down has been really helpful in helping with my brain fog and memory and function like that. And doesn't have as many bad side effects.
Mm-hmm. And are you under the care of one medical cannabis prescriber? And have you had any feedback or input from other prescribers who may be more skeptical that might not have been?
So I do have quite a few people on my team who are 100% positive for cannabis. They've seen firsthand how much it's helped me, so they know that it is really helping. But I have had a couple of people that have been more on the skeptical side. One of my rheumatologists, before I had tried it, had basically told me that it wasn't going to do anything for me and that it was just going to make me sort of lazy and not want to do anything. But I found that it had the opposite effect because I was feeling better. I wanted to do more. So yeah, it definitely has improved my function. So I've had a few doctors told me that it wasn't going to do anything, and yeah, I have told them that they're wrong. So, and that's just from my first-hand experience.
Excellent. And side effects, you said it gives you more energy, but has it made you sleepy, or are there any untoward side effects that you can tell us about?
I'd say probably the worst side effect I've had is that you can get a little bit of a dry mouth at night. And it does make me a little bit hungrier at night, but I actually see that as a positive because I get nausea and stomach issues as a part of EDS. So it actually allows me to be able to eat without feeling sick, which is often really hard for me. So I wouldn't say that that's a negative side effect. I would say that most of the effects are positive. It can make me a little bit sleepy, but I do take it at night. So then that actually helps with my insomnia as well. So I'd say it's all benefits.
Excellent. Okay. Thank you so much for sharing your story. Really do appreciate your time this evening.
Yes, that's no worries.